Hello, my name is Carlos Treichel. I am a nurse and a postdoctoral researcher at the State University of Campinas in Brazil. Today, I will share with you this presentation about the work using theory of change methodology to engage stakeholders in the co-designing of evaluation outcomes. This work was developed within the Entre Redes project, which seeks to implement matrix support, a kind of shared care, in order to improve the integration of the mental health care network in a Brazilian city called Itatiba. Itatiba has 120,000 inhabitants. Its mental health care network counts with 3 specialized mental health services and 19 primary care units. In our project, me and my team, who are linked to one university, form a synthesis and translational system. As a support system, we have an Research Management Committee, aka RMC, which I'll talk about later. And as a delivery system, we have the professionals linked to the services earlier mentioned. Well, it's well established in the literature that stakeholder participation is a core component of implementation research. For a long time, several studies point as positive the participation of stakeholders in the process of designing the implementation and selection of their integration strategies. More recently, the involvement of stakeholders in the design of evaluation outcomes has also been stimulated, as it favors their engagement in achieving the expected goals. Thus, in our study, we report how we use theory of change methodology to promote stakeholder participation in this process. It is important to highlight the path taken by our project until the time of elaboration of the theory of change, since some of the steps were essential for the results obtained in this process. Initially, I would like to bring attention to the formation of the RMC, which, since the project's design, has promoted the integration of local managers, workers, and university researchers in all decisions related to the implementation process. The RMC usually meets every other week and is composed by professionals from different backgrounds, such as physicians, nurses, psychologists, and occupational therapists. There are 10 professionals linked to specialized mental health care services, 6 professionals linked to primary care, 3 professionals linked to the city health department, in addition to 6 professionals linked to the university. It was this group that worked together to elaborate our theory of change here presented. I would also like to highlight the use of an audit and feedback strategy adopted as a step preceding the elaboration of the theory of change. The audit of the mental health network was carried out by analyzing the medical records of patients from specialized services and primary care. Data feedback was initially carried out through the presentation of cluster data to municipal managers and RMC participants. Later, grouped data by service was presented to each of the studied services. This strategy was essential to establish attention for change and to guide the identification of aspects that needed to be changed for the effective adoption of the intervention. In order to elaborate the theory of change, we choose to hold workshops with participants of the RMC. This choice was made in order to establish a more participatory process. Due to the pandemic, these workshops could not be held in person. So, we used the Google Meet platform to hold the meetings and also a collaborative virtual whiteboard through the Miro platform. Thus, comments and notes in the form of virtual post-its could be shared in real time, as well as the elaboration of the graphical representation of the theory of change. Another important methodological resource used was the elaboration of narratives of the meetings. During the meetings, two observers recorded the events and notes taken by the participants in a collaborative way in a Google Docs document. At the end of the meetings, the narrative produced was read aloud, rectified, and validated by the participants. Thus, the narratives could be used as a way to draw the graphical representation of the theory of change between meetings. This was important because during the meetings, the participants found it difficult to draw the graphical representation. But with the use of narratives, members linked to the university were able to carry out these tasks while remaining faithful to the participants' perceptions. After 3 input workshops, a final consensus workshop was held, thus giving rise to the project's theory of change to be seen in the 2 next slides. Here, it is possible to observe the graphical representation of our theory of change, which illustrates the available resources, the planned interventions, some theoretical justifications and assumptions, the intermediate and final outcomes, as well as the way in which they are expected to interact. Here, the legends for each of the components are presented. At the end of the process, 8 indicators were agreed as markers of the success of the intervention. These are 2 qualitative indicators, one being divided into 4 dimensions related to implementation outcomes, and 6 quantitative indicators related to both process indicators and outcome in services and patients. As it can be seen at the image, as a dissemination and reminder strategy, banners with the graphical representation of the theory of change were distributed to each of the network services. So, to finalize, we were able to conclude that using the theory of change methodology to the co-designing of evaluation outcomes in a participatory way was really effective. In the process, we've learned that this can be a very good way to deepen stakeholder participation, thus making them more likely to engage in achieving the project goals. In addition, we understood that developing the theory of change through workshops is a good way to do this, especially after audit and feedback strategies. We also learned that although some adaptations are necessary, it is possible to conduct participatory processes even in a pandemic scenario. And finally, I would like to point out that narratives can be an important resource for the elaboration of a theory of change. I would like to thank you very much for your attention and wish you to have an excellent conference. Bye.